Florian Toti. I am lecturer at the University of Medicine in Tirana and president of Albanian Diabetes Association, and we are part of the EU project DigiCare4You as part of one of the 4 intervention countries, Albania, in the name of University of Medicine in Tirana. As a faculty we have a lot of experience, but with EU projects we don't have a lot of experience. So for us it was a little bit difficult to organize and to create the necessary infrastructure for such an important project. But after that it was a little bit easier for us because it was, as is to say, our daily work that we wanted to implement, but with some changes, with putting in focus the digitalization, which is really a new concept in general and especially for countries like Albania. It was well received by healthcare providers in general and a little bit less but by the general population. But we need to understand that there are 2 groups of age. For the young one, till the age of 50, let's say, it was a very good possibility to put in practice the new technology to create some communications without face-to-face meeting with healthcare providers. On the other hand, for the older people, technology is not very frequent for them to use, but even in this case we had some very special patients that were very eager and very enthusiastic to use it. Even if it is already too early to say, we can see that for some of the patients the possibility to work through digital tools have been very useful, and we can see a drop in the weight, so reduction in the weight, a better metabolic control, and they are more active actually than they have been, let's say, 6 or 9 months before, because for some of the patients it's already the moment to complete the first year screening. The project will finish at the end of 2025 or probably in the 2026, so we have some time to think about it. But anyway, we want to see first some results, because if we want to talk to stakeholders or policymakers, we need to have some results. What is important is that now we have the Ministry of Health, the Mayor of Tirana and the Ministry of Education taking part of this project, and they are already thinking how to implement at least a part of them. What I found very interesting is that for the GPs, when they saw the field risk that we are using for this project, they found it quite easy to use with their patients, and based on the field risk score they can decide what is the highest group in risk for these kind of diseases, prediabetes, hypertension, dyslipidemia, to intervene with these people or to have a closer contact and a closer control on this group of the patient. So I think it will be used even in the future.